So the next tutorial now is on the clinical presentation. Now, for the clinical presentation, you need to know that what? You have to know the clinical presentation of the disease. Generally, the disease, which is a venous disorder, presents with varicose veins. Is it clear? Varicose veins are dilated superficial veins. That is usually how they are going to present. So venous disorder disease presents with varicose veins. That's a major presentation. Or it may not just be varicose veins, but it may also be dilated. You have dilated superficial veins. Is it clear? Dilated superficial veins. You may have varicose veins. Varicose veins is accumulated at a particular portion, and then you have tributaries that are coming out. Those are varicose veins. Is it clear? And then we have the other one, which is we can also have dilated superficial veins. When you have veins which are very prominent on the lower limbs, very prominent veins on the lower limbs. Is it clear? Particularly when you are doing sports, you have prominent veins in the upper and the lower limbs, but that is not associated with the pathology. It is associated with an increase in venous tone. When you are doing excessive muscular activity, you have an increase in venous tone, and that increase in venous will increase the pressure inside the veins, which is also going to result to the dilation of the veins. Is it clear? But the dilation of the veins, you need to know that dilation of the veins of varicose veins are the two major presentations of the venous disorders of venopathies. Now, after knowing the presentation of the center, which is the venous disorder, you need to know the presentation of the cause or the for the pathogenesis. And you see that under the cause, it was divided into the primary and it was divided into secondary. Is it clear? Primary was mostly a valvular disorder, and secondary was divided into superficial and deep. For the superficial, it was a thrombophlebitis, and the deep was a deep venous thrombosis. Now, let's visualize how on your history or the physical examination you can understand primary. So on the history for primary, you need to know that what there is a past history or there is a family history of varicose veins. Is it clear? Or in the history we have a female sex. Is it clear? Associated with primary. Now on the physical examination, how can you know that actually this is a primary venous disorder? For a primary venous disorder on physical examination, you do what is called the Trendelenburg sign. Trendelenburg sign. The Trendelenburg test, sorry. Is it clear? So you do the Trendelenburg test. So now for the Trendelenburg test, what do you do on the Trendelenburg test? What happens is that the patient is first seated. Is it clear? In the Trendelenburg test, the patient is first seated on a bench. Is it clear? When the patient is seated, you see that the lower limbs are going to, in the Trendelenburg test, you see that the lower limbs are going to be having a backflow of blood. So you are going to have varicose veins when the patient is seated. Is it clear? Now in the Trendelenburg test, when somebody after seated having the varicose veins, you ask him now to lie down and you raise the legs. Is it clear? You lie down and the patient raise the legs. Is it clear? When the patient raises the legs, there is going to be backflow of blood up because there is a valvular incompetence. There is going to be backflow of blood up by gravity. So it means that the varicose veins are going to disappear. Is it clear? After you have raised the leg. Is it clear? Now the Trendelenburg test says that what? You place your finger at the level of the saphenous hiatus. Is it clear? You place your finger at the level of the saphenous hiatus and then you ask back the patient to be seated. Is it clear? You ask back the patient to be seated. Now, if there is a valvular incompetence at the level of the saphenous hiatus, you see that there is not going to be any reappearance of the varicose veins. That's the significance of the Trendelenburg test. If there is a valvular incompetence, meaning that the valve at the level of the saphenous vein, at the level of the saphenous hiatus, when you have closed, where you have put your finger. Is it clear? It means that you have obstructed so that the blood should not come back into the lower limbs. Is it clear? If that valve now is the one having abnormality, it means that there is not going to be a venous, a backflow of blood resulting to varicose veins. So you are not going to see again the varicose vein. And when you remove your finger, there is going to be backflow of blood, and then you are going to see the varicose vein, which is going to tell you a positive Trendelenburg test. Now, after the Trendelenburg test, the other test now is going to be the tourniquet test. Still for the tourniquet test, still for the primary venous insufficiency. Now, for the tourniquet test, what happened is that here you have a valve in the preliminary test. The valvular insufficiency or the valvular incompetence was at the level of the saphenous vein, at the level of the saphenous hiatus. Now, for the tourniquet test, we know that let's say that this is the femoral vein, this is the popliteal vein in the popliteal fossa. Now it is dividing into the tibial vein, the posterior tibial vein, and this is the dorsalis pedis vein. Is it clear? Now this is the deep circulation. Now for the superficial circulation, let's say that here you're going to have the greater saphenous vein, and here you are going to have the lesser saphenous vein. The lesser saphenous vein. Saphenous vein. So now this is just a circulation. Here you are going to have the femoral vein. Here you are going to have the popliteal vein. Here you are going to have the tibial vein. Is it clear? So what happened in the tourniquet test is that you need to know that you can have in the Trendelenburg test. What happened is that normally at the end of the greater saphenous vein is going to anastomose this femoral vein, and there are valves here. Is it clear? When you close at this level, you are not going to have normally, if you have abnormality at the level of this valve, every time that you place your leg down, blood is going to backflow from this level into the lower parts. Is it clear? When you have abnormality of this valve. Is it clear? So now if you have pressed here and you have identified the abnormality of this valve, you need to know that you can have again abnormalities down here, because there are also perforating veins that connect the different circulation, that perforating veins, and those perforating veins can have a valvular disorder. Is it clear? So now, in order to identify which perforating vein is having its disorder, you now do instead a tourniquet test. So place yourself between the saphenous hiatus and the upper 1/3 of the thigh. Basically, you place your tourniquet at the upper 1/3 of the thigh. You increase the pressure of the tourniquet. You raise the leg first until the varicose vein is not visualized. Then you increase the pressure of the tourniquet. Is it clear? You increase the pressure of the tourniquet. When you increase the pressure of the tourniquet and then the patient places his leg down, you don't see again any varicose vein. And when you deflate the tourniquet, you realize that the varicose vein reappear. It means that the valvular incompetence is located between the saphenous hiatus and the upper border of the tourniquet that you have placed. Is it clear? Now, if you have not identified, if you have instead inflated, and then if you have raised the leg, you have inflated, and then you put down the leg, you see that there is backflow of blood. Is it clear? It means that the problem is coming down, because if you put a tourniquet here, you see that you raise the leg, all the blood is going to enter into the deep circulation, and when you put the leg down, the blood is going to move from this deep circulation and go back to the superficial circulation. It means that there is no significance of the tourniquet at that level. So what you do is that you deflate and then you go down another third of the thigh. Is it clear? So in the second third of the thigh, you inflate the tourniquet. You first raise the leg to first make the varicose vein to disappear. Then you inflate the tourniquet. and then you put again the leg down to find if the varicose vein appears. If the varicose vein appears, it means that the problem is located down. But if the varicose vein does not appear, and then you deflate the tourniquet and then it appears, it means that the varicose vein is it means that the abnormality is located between the first place that you have placed the tourniquet and the second place that you have placed the tourniquet, and that can help you to localize the abnormality for the surgery. Is it clear? So that is a tourniquet test that is used in order to identify the primary venous insufficiency. Is it clear? So we have two major tests involved in order to identify primary venous insufficiency. You have the triangular test and you have the tourniquet test. Now the next thing we continue now is a secondary venous insufficiency.